ACL. What is ACL?
ACL, also known as anterior cruciate ligament of knee, is the single most important intrinsic ligament of knee. This is our knee joint, which is junction between two bones. The top one is the thigh bone or femur, and the lower bone is the leg bone, shin bone, or the tibia. These two bones are joined by two external ligaments called collateral ligaments, and there is something called anterior cruciate ligament which connects the two bones inside the joint. This ligament, which goes from front to behind, is known as the anterior cruciate ligament or the ACL. Now, this ligament is very important to maintain the stability of knee. If a person's anterior cruciate ligament is injured, the person feels a sense of insecurity or instability at knee while running, while jogging, or while playing. And the anterior cruciate ligament is important to the extent that it's said that ACL tear is the beginning of the end of the knee. So ACL tears must be treated by various methods, either conservatively or by surgery.
What is its role in the knee and walking?
Anterior cruciate ligament is supposed to be the stabilizer of knee. When we walk, when we turn around, it's the ACL, anterior cruciate ligament, which stabilizes the knee, and moreover, it's also the position sense organ of knee. For example, when we are playing or when we are jogging or when we are suddenly turning around, it's the ACL which senses the position of knee and maintains balance in the knee. Anterior cruciate ligament is so important that it's told that an ACL injury is supposed to be the beginning of the end of the knee until and unless it's treated well. And that treatment, how it is done, we will see subsequently.
How does it get injured?
Anterior cruciate ligament is not an uncommon injury of knee. It's pretty common, and there are various mechanisms in which it gets injured. Primarily, it's a sports injury. People playing football, hockey, they tend to injure the ACL while turning around and running. Along with that, along with sports injury, it's also injured by road traffic accidents. Most commonly, it's injured in motorcycle accident or head-on collisions. Uh, Anterior cruciate ligament may be injured. Thirdly, in the elderly age group, sometimes it is injured by a simple twisting of knee, or even there can be indirect injuries, like if a person goes inside a sea and there is a sea wave which comes and it can injure the anterior cruciate ligament. So these three form the major patterns of injury, and but still primarily anterior cruciate ligament injury is a sports injury which is incurred in contact sports like football or hockey and other sports.
What happens in ACL deficient knee?
ACL deficient knee primarily is an unstable knee. The person continuously feels or harbors a feeling of insecurity at knee. Whenever a person is walking, jogging, or climbing stairs, up and down stairs, the person continuously feels that the knee is insecure. This insecurity is a manifestation of micro instability of knee. Along with that, sometimes there are macro instability. Macro instability means suddenly the knee will give way, suddenly there is episode of giving way of knee, and it is followed by intense pain, swelling, and redness of knee. So this macro instability or giving way of knee in turn injures the residual cartilage of knee, and this process keeps on accelerating the osteoarthritis of knee. So ACL tear leads to accelerated secondary osteoarthritis of knee. That's why it's said that ACL injury is the beginning of end of the knee.
What are the immediate and late symptoms of ACL injury?
Acute ACL injury, that is the time when the ligament is actually injured, it is followed by immediate hemarthrosis of knee. What it means is that the knee is swollen, and it is swollen because of internal bleeding. There is blood collected inside the knee, there is immense pain, there is restriction of movement, it's not possible to fold one's knee or straighten one's knee, and it is a feeling of gross instability of knee. Person will not be able to walk. So this is the symptoms of an acute injury of knee. And once it goes into a chronic phase, for example, several months after the acute injury, then person feels a continuous feeling of insecurity or instability of knee, which can be small micro instability or episodes of giving way, which is called macro instability of knee.
What is the immediate treatment?
The immediate treatment of an acute ACL injury is rest. That means we have to put the person to rest. We have to immobilize by giving a knee brace, and we have to give a lot of ice compress to decrease the swelling, and we give anti-inflammatory injections either in tablets or injections. So this is to cool down the immediate inflammation and the immediate trauma which is incurred after ACL injury. And the late treatment is reconstruction of the ligament.
What is the definitive treatment?
The definitive treatment of ACL injury is reconstruction of the ligament. For example, what I mean is that once a patient recovers from the acute episode, which is characterized by intense pain, swelling, and restriction of movement, once a person recovers from this acute episode, we start muscle strengthening or muscle building exercises, which includes the quadriceps and the hamstring muscle building exercises. These two are most important stabilizers of the knee, and along with that, on a planned way, we reconstruct the ligament. The ligament which is torn inside the knee, it is not repairable. So we have to reconstruct a new ligament, and for that we use various grafts from our own body, and we reconstruct the ligament through an arthroscopy, that is keyhole surgery.
What exercise are to be done for ACL deficient knee?
For an ACL deficient knee, we have to try to strengthen the quadriceps and hamstring muscles. For that, we need to do something called closed chain exercises. What it means is that those exercises in which the agonist and the antagonist muscle, that is the quadriceps and the hamstring muscles, are exercised simultaneously. If a person goes to gym, he or she can do leg press exercises, he or she can do static cycling, he or she can do half squatting exercises, and there are stepping exercises. Then there are exercise aids like therabands which can be used for muscle building. Once the muscles become strong, they gradually tend to stabilize the knee, and this muscle building exercises should be started before the surgery. I mean, the person should be trained in these exercises before the surgery, and it has to be continued after the surgery also. So these muscles help in stabilizing the knee along with reconstruction of the ligament.
What is ACL reconstruction?
As we have just discussed, that a torn ACL cannot be repaired, it cannot be stitched. So we have to put in a new ligament. This is what ACL reconstruction means. A new ligament. Now this new ligament is a autograft. What autograft means is that we take a tissue or a tendon from our own body, and then we construct tunnels inside the bone in the natural anatomical position of the ligament, and then we put in the new graft, which is known as the ACL reconstruction. In this reconstructive process, the graft is fixed in the two bones, that is the lower bone tibia and the upper bone femur, by using fixation methods which can be something called bioscrew or endocell, and various other fixation methods are there. The whole process is done under a keyhole surgery, which is arthroscopy. That means a small telescope is put inside the knee, and then it is viewed on a big TV screen, and through a small portal or a small hole, the entire surgery is done.
What grafts are used?
As I told, that ACL ligament has to be reconstructed, and for that we use a person's own body tissues. Now grafts can be autograft, that means from person's own body, or it can be allograft. Allograft means it is through a tissue bank, that other person's body tissues can be used through a tissue bank, but we do not do that. We prefer to use autograft because it is safest, it has highest chance of graft uptake and least chance of rejection. So the autografts that are most commonly used is the hamstring tendon graft, which is known as semitendinosus graft. This semitendinosus tendon is harvested and a quadruple stranded graft is prepared. Other grafts which may be used are quadriceps tendon graft, there can be patellar tendon graft, or there can be tensor fascia lata graft. All these grafts can be used for ACL reconstruction. Personally, I use mostly semitendinosus graft, which is quadruple stranded semitendinosus graft.
What implants are used?
As we discussed, a graft which has been harvested and fashioned according to the thickness of the ligament has to be fixed in the upper bone, which is the thigh bone, and the lower bone, which is the shin bone. Now this fixation has to be there till graft incorporates inside the bone and it becomes like a natural ligament. Till then, there has to be a strong fixation to take a person's to take the stress of walking or knee bending and all those things. So that fixation is done by something called bioscrew. Now this is known as interference screw, that which fixes the graft inside the shin bone tunnel and the femur thigh bone tunnel. So these implants are called interference screws, and these are made up of polygalactalic acid. That means these screws gradually dissolve on its own with time, which may be 6 months, 9 months, and they gradually get incorporated in the bone. So we just discussed that once ACL is torn, it has to be reconstructed by using various grafts. Now what it means is that this is a model of a knee, and the ligament is here between the two bones. The ligament looks something like this between the two bones. So during reconstruction, we make a tunnel in this bone, which is the shin bone tibia, and we make a tunnel over here in the femur bone, and the graft is routed through this tunnel and through the tibial tunnel to the femoral tunnel. In between, it holds the two bones in between the knee joint, and over here in the tibial tunnel it is fixed with something called interference screws, and over here in femur tunnel it can be fixed with interference screws, or loops can be used. These are known as implants for fixing the anterior cruciate ligament.